Good morning. This is Gary Deal, Chairman of the Culpeper County Board of Supervisors. We have had many public COVID-19 Emergency Board of Supervisor meetings since March, and today is the second public service announcement meeting we have conducted. We will carry today's broadcast with Spanish subtitling. With me today is Mayor Mike Olinger, Culpeper Medical Center Hospital President Donna Staten, and the Director of the Virginia Department of Health, Dr. Wade Karchner. Director Bill Uten of our EMS staff was going to be here, but unfortunately, he came down with symptoms yesterday, was tested, and is waiting for results. You are in our prayers this morning, Bill. Each person on our panel today will say a few words, and then we will have a question and answer period at the end, which I think will be very informative. We are here today to discuss the latest COVID impacts, updates, community outreach operations, and the direction going forward. I know there are many of you that are concerned about our positive case numbers increasing at a significant rate for Culpeper. We have been very proactive with testing, more than most jurisdictions. This, of course, has increased our positive case numbers. We are in the midst of an outreach program pushing aggressive testing, promoting self-isolation, and medical assistance for those that are symptomatic. Let me remind everyone, we are still at 5 deaths for Culpeper, which I take as very positive. We do not want any deaths, but that total death number is what we are focused on and why we have ramped up aggressive testing and community outreach. We want to stay on top of this and keep that death total where it is. So I encourage everyone out there to understand this, stay informed, but try not to obsess. Everyone on our panel today will give you vital information to keep you informed. As I always state, if you need assistance during these challenging times, please call your Board of Supervisor representative, according to the district you live in. Our board members are here for you and are very active during these challenging times. Many concerned citizens, business owners, and employees have been calling us regularly. You can call Brad Rosenberger if you live in the Jefferson District, Bill Chase if you live in the Stevensburg District, Jack Frazier if you live in the Cedar Mountain District, Tom Underwood if you live in the Salem District, Paul Bates if you live in the Catalpa District, Kathy Campbell if you live in the East Fairfax part of the town, and myself for West Fairfax, which is the other portion of the town limits. So contact us. That is why we are here. We are glad to have Mayor Olinger with us today. Our mayor has been very active, and we can't thank him enough for his town and community leadership during this time. Mayor Olinger, I will turn it over to you now.
Good morning. My name is Mike Olinger, and I'm the mayor of the town of Culpeper. The rate of citizens testing positive for the coronavirus continues to rise with significant increase this week, partially due to testing being more readily available in Culpeper. This has placed Culpeper County in the unenviable position as being among the highest per capita exposure rates for counties in Virginia. It is more important than ever for us to all do our part by continuing to social distance, wash your hands, and clean surfaces regularly. And when we must be in public, to wear a mask to minimize the spread of the coronavirus. Supporting our local business is vital during this unprecedented economic downturn. I have scheduled a special council meeting next week and plan to request the support of my fellow council members to pledge federal CARES monies recently earmarked for the town of Culpeper toward a small business grant program. I hope that Chairman Deal and the Board of Supervisors will join me in that pledge with the county's recently earmarked funds. Times are hard for local governments, with the town and county revenue and expenditures being significantly impacted with this pandemic. But our small businesses are also hurting, and local government needs to do its part to help the local businesses weather through this. One is not exclusive of the other, and we can do both by getting back to work, supporting our local economy, and minimizing the spread of the virus. I want to thank our first responders, public service employees, and utility employees for everything you're doing to keep Culpeper safe with the lights on and the water flowing. I also want to thank the support teams behind them that keep them on the front line. Together we will beat the coronavirus and return our town economy to what it was before this pandemic. As we get back to our lives as they used to be, I want to thank all of the citizens in advance for doing your part in keeping Culpeper safe and doing your part to boost our local economy. Thank you.
Thank you, Mayor Ollinger, and I'm with you. I look forward very much to our upcoming town and county interaction committee meetings, and the town and the county have been working well together during this crisis, and we thank you and the town county staff and the other council members for working with us. At this time, I'd like to turn it over to Ms. Donna Staten. She's here today. She's the Culpeper Medical Hospital, our local hospital president, and what a job that she's been doing and her staff have been doing out there. We can't thank them enough, and I speak with our EMS staff all the time, and they're always bragging about Donna and her staff and the health workers out there, what a tremendous job they are doing. So Donna, I will turn it over to you now.
Thank you, Chairman Deal. I really appreciate those kind remarks. And what I can certainly say is that we have been living for the last several months in very unprecedented times. I could not be more proud of the work that our healthcare team has been doing. The focus on providing safe patient care to our community. Our number one priority through this entire experience has been the safety of our team members and our patients. As many of you learned through some of our communication, several weeks ago we began to resume medically necessary, time-sensitive procedures for our patients. So what does that mean? That means that procedures that would otherwise be deferred would cause problems for our patients or harm. We are starting to resume those cases. These procedures were paused in mid-March as a result of the increasing number of COVID-19 cases across the state of Virginia. Imaging lab and other appointments to support these procedures have also resumed. However, we are not performing elective surgeries at this time. What I can share with you is that that is a very, very small minority of the number of procedures that we would provide to our community. Really, things that fall into this category would be things like cataract surgery. All other procedures that are being performed are essential services for the safety of our community and our patients. Virginia Governor Ralph Northam said that in order to resume elective procedures, there must be a 14-day decline across our health district prior to resuming these types of cases. As has been shared by Chairman Deal as well as Mayor Ollinger, we're still seeing the number of cases in our health district rise. We are very responsible from a quality and safety standpoint and monitoring these numbers daily to ensure that the safety of our community is our number one priority. We anticipate that over the course of the next several weeks, we will be able to increase the number of services being offered. However, our top priority remains the safety of our patients, our team members, and the community as a whole. Each case that we are scheduling is going through a thorough review and scoring process by a panel of physicians to verify that they meet the criteria to be performed at this time. This review helps to ensure that we have all of the resources available to handle these cases, along with the additional demand of any COVID-19 cases in our community. What I might add is that we are ensuring that we have the ability to surge up by an additional 25% at any point in time. That includes the necessary staffing, the necessary medications, as well as the necessary personal protective equipment. We have also added a number of additional safety measures to include patient and team member masking across the entire health system, temperature screenings for all team members, visitors, and patients at every entrance, enhanced cleaning processes and protocols, and also we've added additional resources to our infection prevention team at this time. We're also ensuring that we are taking a strong stand on physical distancing and additional clinical safety concerns. In response to this, we are ensuring that we continue to operate under restricted visitor guidelines with very, very few limited exceptions. We have also reduced the number of patients that are allowed into our clinics at any given time. We also have ensured that all of our waiting areas include appropriate social distancing. We've introduced workflows to reduce the use of waiting rooms. We actually, now the most popular waiting room is in your car. So I can attest to you that this is actually being really well received by our patients and community. And we are also meeting patients in their car where appropriate in order to provide care. We've introduced all of these protocols in addition to screening and testing patients prior to any procedures being performed in order to limit their exposure to respiratory illnesses in our facility. We still continue to work in alignment with the Center for Disease Control and Prevention guidance. We ask that if you come to the hospital for your care, that you please bring a mask. If you do not have one, one will be provided to you at one of our designated entrances. For more information, I would encourage you to go to our website. Novant Health UVA Health System has an exorbitant amount of information out there regarding our coronavirus preparedness, our response, and what we're doing to ensure that the safety of our community continues to be our #1 and top priority. With that, that concludes my updates for today. Thank you, Chairman Deal.
Thank you, Ms. Staten. Those were very good comments. And now, as I said, Director Uten couldn't be with us today because he came down with symptoms and is waiting for test results, but he did want me to read his comments today, and I will do so. Culpeper County Emergency Services will be providing an update on our response to the COVID-19 pandemic. Please follow us on social media where we frequently post information related to COVID-19. We have continued to collaborate and coordinate with our federal, state, and local partners. We also continue to update our local emergency response plan as needed to assist with our response here locally. All of our stakeholders receive the updates as we release them. Locally, we have completed N95 fit testing for the staff of one of our long-term care facilities and several volunteer fire and rescue companies. We are also coordinating fit testing for the staff of another long-term care facility here in Culpeper. Culpeper County Emergency Operations Center continues to serve as the hub of distribution of PPE to our local partners. We have acquired PPE from state resource requests that are being fulfilled by the Virginia Department of Emergency Management and also private vendors. All of our private vendors have been vetted through VDM, and we maintain a fluid list of materials needed to purchase. When the PPE is delivered, we compile burn rates and distribute throughout the county as needed. We have fulfilled multiple requests for N95 gowns, goggles, thermometers, surgical masks, and hand sanitizer to our partners, with our first responder community being a priority. We have also established a decontamination policy for our first responders. On a rotating schedule, we decontaminate fire, rescue, police, and sheriff's office facilities utilizing an electrostatic sprayer. Decontamination of ambulances after transport still remain in effect. We also have made available our decontamination shower at EMS Station 12 for any law enforcement partner that may have had exposure and is in need. We also will decontaminate the officer's vehicle while they are using the facility. Throughout the county, we have seen an increase in testing capability. Walmart has currently established a testing location in their parking lot. This is a drive-through model and is open for anyone without a physician's referral. You can pre-register for this service at doineedacovid19test.com. And I'll repeat that one more time. doineedacovid19test.com. Once registered, you will select an appointment time. Walmart testing is performed Monday, Wednesday, and Friday from 7 a.m. to 9 a.m. and is located at 801 James Madison Highway in Culpeper. They are testing 40 people a day on those 3 days. Culpeper County Emergency Management also participated in a drive-through testing site established in conjunction with a food drive for uninsured or underinsured high-risk groups, in which 185 tests were conducted. This testing is critical as we continue to attempt to slow the spread of COVID-19. With the success of the drive-through testing, future plans are in the works to establish a similar event. These discussions also include the possibility of mobile testing. Many thanks to our partners for their involvement in this project and all the volunteers that participated. The National Guard conducted a point prevalence survey testing at one of our local businesses last week. There were 110 tests administered at this location. The request for the National Guard assistance was a collaborative effort between the VDH and the business themselves and was requested as a proactive measure to provide that testing to their employees. We requested those resources on behalf of the VDH through VDEM. And that's all from Director Uten. And thank you again, Director Uten, and we're thinking about you now. And we will go on to Dr. Karchner. We are glad to have Dr. Karchner with us here today from the Virginia Department of Health. And I know we've had some challenging times over the last several months as far as negotiating support and communication and resources, but I think over the last week or so, things have gotten much better. We're going forward with VDH in a very positive manner, and I can't thank Dr. Karchner enough for being here today, and I'd like to turn it over to him now.
Thank you, Mr. Deal, and good morning, and many thanks to those who have participated so far this morning. The coronavirus has had an incredible impact on the community, and we have seen ramped up testing, we have seen an increase in the number of cases. This is to be expected, and it does point to the burden of disease in the Culpeper area. We also know that a disproportionate number of cases have hit the Hispanic community hard, and we are working closely with a number of our partners in the community to facilitate testing and follow-up. I would like to provide some insight into what the health department response is on the back end of all of this testing, because most people are not aware of the hours of work that go into this behind the scenes. When the health department receives a positive lab result, a team of investigators is assigned the case, contacts that person and all of their close contacts, and provides isolation and quarantine advice, information, letters for work, and follow-up phone calls to see if the case or the contacts have new or worsening symptoms. As one can imagine, working through a single case can take up to 3 to 4 hours. When we receive more than 200 cases over 4 days, as we did earlier this week, our 24 staff assigned as investigators easily have the potential to be overwhelmed. These teams have been working 7 days a week for the last 2 months. We also have staff assigned to work with restaurants on guidance through the various phases of the shutdown and the reopening, staff reaching out to businesses where complaints are received, manning the local hotline, as well as taking care of those essential functions that cannot be delayed even during a pandemic. And to accomplish this, our health district staff consists of about 60 people spread over 5 counties. I would also like to address some comments on the increased number of cases in our Hispanic community. We know that COVID-19 has affected communities of color throughout the nation, disproportionately, including the Virginia Hispanic community. Unfortunately, the disparities and inequities that existed prior to the pandemic are reflected in these communities that are feeling the brunt of the illness, whether on the Navajo Nation in the Four Corners area, the African American community in New York City, or the Hispanic communities throughout the Northern Virginia region. The results are similar. The coronavirus does not discriminate, but the impact it has on various subpopulations does. The crowded living conditions, lower paying jobs that don't allow one to telework, fear of being fired or worse, and lack of health insurance make it very challenging for this vital part of our community to adhere to public health recommendations to isolate and quarantine. We have seen these difficulties as we perform our contact tracing efforts every day. The contacts with this community now have reached the thousands. On a personal note, the team following the case of a Hispanic woman who eventually passed away a few weeks ago. The team contacted the husband every day of her hospitalization, brought face masks to the family. On 2 occasions, purchased food out of their own pockets and purchased a peace lily for the family when she passed. Many, many tears were shed that day in the health department. This is heart-wrenching for all of us. On an even more personal note, I know and understand the people from Latin America. I've lived with them and worked alongside them. I'd like to close with a message for them. Señores y señoras, hermanos y hermanas, gracias por la oportunidad de hablar con ustedes. Yo me llamo Wade Karchner y soy el director del Departamento de Salud del Condado de Culpeper. Viví en Latinoamérica por más de 2 años. He vivido entre ustedes y he trabajado junto a ustedes. Sé de su carácter y fuerza. Sé del amor que llevan por sus familias. Esta pandemia ha causado mucho problema para muchos de ustedes. Ha afectado muchas vidas, sobre todo en su comunidad. Tengan en cuenta que el Departamento de Salud está luchando para comunicarse con todos ustedes. Nuestro deseo es que todos puedan superar estos tiempos de manera segura y saludable. Teniendo esto en cuenta, si el Departamento de Salud se comunica con ustedes, tratan de seguir las recomendaciones que ofrecemos. Además, todos recuerden lavarse las manos con frecuencia, quedarse en casa cuando estén enfermos y usar una mascarilla facial cuando estén en público. Desde mi corazón a los suyos. Gracias. And in closing, I just would like to say to reach the health department for questions or concerns about COVID-19, go to ask RRHD at bdh.virginia.gov or call our hotline at 540-316-6302. Thank you.
Thank you, Dr. Karchner, for that fine message. And now we will go into our question and answer session. And I'll start it off for Dr. Karchner. Can we expect assistance from the Department of Health for inspections of businesses if we get complaints on a business not following the phased criteria and OSHA guidelines? And what is the protocol again on that, Dr. Karchner?
Yes, we already have received complaints throughout the district and including in Culpeper County and the town. And we have reached out to those businesses that have come to our attention already. The best way to call would be to call the hotline number. It's the easiest way to reach somebody, and then they will reach out to initially to our environmental health program manager, and he will assign that to the people living in the various communities.
Okay, thank you, sir. And then a follow-up question to that. If you receive a hotline call from someone that works at a business or is associated and maintains an employee as tested positive and continues to work at that business, how do you handle that? And what is the protocol with that and the disinfectant, the shutdown part of it?
We do certainly try to have that communication up front with the business owners. The contact tracing teams are the ones that make that initial contact with the person who has tested positive, stressing to them that they need to isolate and quarantine. If they don't, then our contact teams will contact the environmental health, or if that comes from a business owner or people that are aware of that, then we do go in and have the discussion with them. What we've found with a number of businesses, particularly those businesses that do have the more of a larger corporate presence, they have been very proactive. And as an example, the certain fast food restaurants, if they have a case there, they have shut down for a day, done a deep cleaning, and brought in an entirely new staff. So we have seen that happen around the district and including at least once here in Culpeper since this has started.
So someone with complaints again should call that hotline
Yes.
number. And what was that hotline number again, Dr.
It is,
Karchner?
yes, 540-316-6302.
Okay. And I believe Mayor Ollinger has a question or two, too.
Question is for Donna. Could you speak to how many people you currently have hospitalized with the virus? And have you seen a surge in the number of folks since this last round of testing? And are we fully equipped to handle a surge if we have a large number of folks that show up?
Yeah, that's a great question. So let me kind of break that down into a couple of parts. In terms of being able to respond to surges, we absolutely have the capacity to do such, not only with staffing, but also personal protective equipment. What I will share is that based on the acuity of the patient, we do have some limitations. And that's where we rely very heavily on our partners with UVA, as well as the other facilities that are part of Novant Health UVA Health System. We have had to transfer several patients to UVA for a higher level of services that we do not offer at Culpeper. I believe we've only transferred a total of 4 patients from our facility for those types of services. We've been very successful in treating and releasing over 29 patients from Culpeper Medical Center. And at present, the number of patients that we are providing care for, it does fluctuate directly in accordance with the positive cases in our community. We have been as low as 0 since the beginning of April, and we have been as high as 14. So those numbers do shift Some patients stay 2 or 3 days. Some patients have stayed over 3 weeks. So we should expect with the increase of point of prevalence testing as well as positive cases in the community, that probably within 7 to 10 days we'll see additional demand for patients requiring higher level of services. And at that time, we have no problem. I feel confident that we'll be able to meet those needs of our community.
Thank you, Donna. And I have a question too for Donna. What protocols are in place to protect our nursing home communities?
That's a great question. So we actually began partnering with our local nursing homes very, very early in this, specifically because those populations are very high risk based on the cohorting that's in place, and also due to the fact that many nursing homes do not have the ability to isolate patients because they are rooming in with others, or they don't have negative pressure rooms. Because this virus is airborne, if a patient requires any form of aerosolizing procedures, which could be a nebulizer, ventilator, anything like that, you must put the patient in a negative pressure room to ensure that the spread of the virus is kept to a minimum. So what we've done specifically with our nursing homes is put in place a protocol well over a month ago that we do test every single patient that is discharged to a nursing home to ensure that they are free of COVID-19. I can successfully share with you that we have not had one discharged patient that has tested positive. And that I think is a result of the very close working relationship that we've put in place, as well as the protocols that our nursing homes have instituted very early on in the process. We've also worked with them for N95 testing, as Bill Uten mentioned in his report, and we do have daily conversations around placement needs, and have in fact extended the stay of many of our patients that were ready for safe discharge to a nursing home due to concerns of the nursing home to be able to accept that patient back safely. So there's a lot of collaboration, a lot of coordination, but most importantly, the safety of our patients is our number one priority.
Thank you very much, Donna. Again, a question for Dr. Karchner. I hear a lot about the testing results for positive cases reflect multiple tests on one individual. I know that's not the case, but for the citizens listening, could you give us some correct information on that, Dr. Karchner?
I'm not quite sure I understood the question.
I think there is a situation where people think that there being multiple tests on one individual that go toward our numbers every day that come out as far as positive cases.
Mm-hmm. Yes, the Virginia Department of Health approximately 2 weeks ago in their grand counting of test results started adding in the antibody tests, and they've now separated that out again on the state level. I will tell you that the test results for our health district in each one of the counties has no added antibody tests in it at all. They're all separate and unique tests for a person using the PCR methodology.
Thank you, sir.
Mm-hmm.
Okay, I have another question for Donna. I get called often by members of our NAACP, Thunder Lane and Sanford Reeves and Sandra Reeves Yates, asking how COVID is affecting our black community here in Culpeper. Can you comment on that, Donna?
From a hospital standpoint, I would say that we have not seen a disproportionate impact to our African American community at all. I think has been shared by our other team members here today. What we have seen is a disproportionate impact to our Hispanic community. But I do feel that the social distancing, the safety protocols that we've been working so hard to educate the community on have absolutely worked. So I can attest, at least in our health district for Culpeper Medical Center, we have not had the experience of a large inpatient population of African American patients.
Thank you, Donna. And for Dr. Karchner and Donna, if they would like to comment on this. I hear a lot about many people believe in the approach of we have to let this virus run its course. Can you comment on that as well as and antibody testing as well?
As you say, it is a controversial approach, and I think that we as a health district, we as a county, as a state and nation, and even the world, we have to walk a tightrope. We have to thread the needle, because every choice we make regarding opening up or shutting down carries with it consequences. And consequences of opening up too quickly mean more cases for the hospitals and more death sooner for members of the public. But we also need to realize that shutting down or not opening up carries with it, together with all the other issues that we know, such as depression, suicide, medical conditions that don't go treated, domestic violence, and the lack of education and the lack of exercise and recreation has a life and death impact on a community and on a society as well. So I think there really needs to be a balanced approach, and I think as a society we've become much too polarized on that approach, and we really need to, like I said, thread that needle in it, and it's a hard needle to thread.
Thank you, sir. Donna, would you like to comment on that?
Yeah, just one kind of brief comment to add on, and I've shared this in some previous media communications, but the ability to get to market a vaccine will be likely 18 months. So we as a community need to learn how to essentially coexist with this virus for the foreseeable future. And we have to be responsible. We have to take appropriate safety precautions. We have to ensure social distancing. We have to try to minimize the spread of it to the extent possible. So I think what is upon us is determining how to restart our economic engine in a way that is safe and fiscally responsible without being reckless. Certainly, I think if we go in and, fail to educate the community on the importance of different safety controls, we are being reckless. We will see a huge uptick in the spread of the virus. We will overwhelm our hospital. As we begin to slowly phase back the opening of services, it will take a minimum of 2 to 3 weeks to see the impact of that. So I think we have to be very deliberate and very methodical about how we open our community back up, because it will be a lagging indicator to see what the impact of decisions that we make today and how those will respond within the community. So I think back, Chairman Deal, to your original question, we have to learn how to create a new normal, and whatever that may be. And that is a function of all of our partners coming together, working together, being educated, and making good decisions based on the well-being of our community. I do feel that the testing event that we partnered with last Saturday was a great example of that. And I think more of those instances will come to play. And, communicating with our community on it is safe to go out in the community. You just have to be thoughtful about how you do that and not be reckless. So with that, I think Culpeper Medical Center is, absolutely a safe place to seek care, probably far safer than going to Lowe's or Walmart. I would have to attest. So I would encourage you to resume your normal operations, resume your normal day-to-day, but do it in a way that you're informed and educated and responsible. Thank you, dear Gary.
Thank you, Donna. And I have a question for both of you if you want to address this. The adage of, if we test less, we will have less cases.
That's a true statement, but that statement doesn't get us anywhere. If we did no testing, certainly would have no identified cases. But again, that doesn't help from a public health standpoint. We need to know what the prevalence of a disease is in a community so we can know how to best address that and educate and inform the public. The more testing you do, the more cases you will get. And that we need to recognize that, understand that, and work through that, because it impacts what we do as an agency, and it impacts the hospital as an agency. But to turn a blind eye and not test would be pointless.
You know, I would add on, and I think that not testing is irresponsible, because data allows us to make informed decisions. It allows us to plan, it allows us to prepare, it allows us to anticipate what the need for resources are in our community. If we choose not to test, it does not mean that those cases don't exist. They still exist in our community. And I think this past week's testing increase and the uptick of cases validated what we already knew was in existence in our community already. And so back to Dr. Katchner's point, testing allows us to be more responsive. It allows us to take a more informed approach on how we're responding to the needs of the community. The absence of testing allows us to stick our head in the sand and pretend like the problem doesn't exist. It is real, it is here, and the more information that we have to be able to respond to the upcoming needs, we will be better prepared in the long run. Thank you.
Can I add one more thing to that? Along with what Donna said, testing is not a panacea either, because whether you test or not, a person, if they have COVID-19, they are going to, if they're going to get sick or not, that's going to happen whether they have the test or not, and they're going to show up at her hospital, whether we test or not. So that portion of the whole pandemic is not going away whether we test or not. The testing is really important for the public health aspect, really for us to tell folks, you're positive, you need to stay home, you need to quarantine, and your close contacts need to do that. And then everybody, if we know the numbers are going up, everybody will be more responsive to the messages of wash your hands, cover your face if you're out and you can't keep away from other people, and to wash your hands. Again, I can't say it enough. It sounds like rote and silly messages, but that's really what we have, is staying away from people and keeping yourself with your hands washed and chapped.
Thank you. And I have one final question that I hear a lot is people are just wondering when the curve, in your opinion, will level out.
I think there have been many people that have made many guesses and projections over the last 2 to 3 months that have been erroneous. And so I would like to see it to start to drift down. I hope in the next 2 to 3 weeks that we will do that. But again, as a prognosticator, I'm not any better or worse than anybody else on television or radio out there.
So this is very science-based, but when you conduct an experiment and you change the variables, you should expect different results. So operating under a complete lockdown, as we have been doing so for the last 2 months, we're now seeing the impact of shutting down all services. As we change those variables and we begin to open up safely certain things, the variables are changing. So as a result, we're going to see a different impact in our community. And to my earlier point, it's going to take 2 to 3 weeks for us to see the impact of that. I shared at our State of the Community with our chamber event last week that UVA has been doing some pretty robust modeling about when we can expect the curve to flatten, when we can expect the peak. Projections from UVA, which again, every model has its pros and cons, and there is no perfect model out there, suggest that we will see a peak in August as a result of phasing opening our communities in the early June timeframe. So I think we won't know until we get there. Ultimately, I think it's everybody's guess. Some of the models have a higher degree of confidence than others, but when you look at China, they are actually beginning to see another uptick in China as a result of reopening their community, and I think we should expect to see the exact same in several months. Thank you.
Thank you, Donna. And I forgot one question. Can you comment on tracheal intubation versus putting a tube down a patient's throat? Can you comment on that, or Dr. Karchner?
Not having worked in an ICU for over 35 years, the typical intubation is done endotracheally, where it's passed down through the trachea. What they have been doing when they have patients on a ventilator for a prolonged number of days, usually when it becomes more than a week or two, what they will do is they will perform a tracheotomy and put the breathing tube through from the outside into the bronchial tube directly. And that just allows the patient to be managed better and differently than they normally would through the regular endotracheal tube, which we're more familiar with.
Thank you, sir. Mm-hmm. Mayor Ollinger, do you have any more questions? Or?
No, I'd just like to make a couple closing remarks if I could.
Go ahead, sir.
I'd like to thank everyone that was here this morning. This was very informative, and I hope the citizens find it as informative as I have. And I'd like to say how proud I am of our community, our first responders, and what you do every day. I encourage citizens to make informative decisions when they're out and about, social distance, and continue to wash your hands and be safe. Thank you.
In closing remarks from me, I think this has been a very informative meeting as well. And the one reason we are all up here today is to inform you, to calm you, and to urge everyone to keep working together. We saw that last weekend when everyone came together, as Donna had said earlier, within a matter of days to offer free testing in consolidation with the food distribution event. That was an amazing effort, and I would like to thank everyone involved. I would like to thank Yannette Garcia and Norma McGuckin, who are representing and acting as an intermediary to our Hispanic community. These two are going above and beyond their call of duty to care for their community. Our first responders and healthcare workers continue to serve our community with courage and fortitude. Additionally, everyone working to serve at our businesses in our community, we truly thank you. You are very much appreciated, and you are essential in providing the services we need at this time. In closing, I urge everyone to take the health guidelines seriously, maintain your spacing, wash your hands, like Mayor Ollinger just said and Dr. Karchner. If you have symptoms, seek medical assistance and testing, and stay home and self-isolate if you are sick. Everyone needs to stay focused for the safety and well-being of yourself and your families. I would again like to thank Mayor Ollinger and Donna Staten and Dr. Karchner for being here this morning. Special thanks to John Krawchuk and Culpeper Media for allowing our Culpeper citizens to access this broadcast. Have a good day, everyone.